Check 1, 2. Check 1, 2.
Good afternoon. Good afternoon. I have the distinct privilege, let me move this. I have this distinct privilege to welcome all of you to this learning session entitled Advances in Innovative Uses of the Regional Revolving Funds. Today, a number of experts will present progress on their new priorities for revolving funds, PAHO's revolving funds, which involve greater flexibility and innovation for their use. Member states, as we've already heard, are grappling with aging populations, increasing rates of infectious and non-communicable diseases, and ensuring that hard-to-reach communities have the vaccines, medicines, and health technologies that they need. PAHO revolving funds offer technical cooperation in forecasting and pooled procurement to access such products. By consolidating forecast demands and leveraging economies of scale, as well as through transparent negotiations with suppliers and innovative acquisition strategies, the PAHO revolving funds improve its purchasing power for safe, efficacious, and high-quality medical products. We hope this session is not only for learning, but to generate ideas from our member states and others to expand the strength, the reach, and the impact of our revolving funds. So you have the agenda before you. I will not go through it with you, but let me turn to Dr. Jarbas Barbosa to begin our session.
Thank you, Lu. Good afternoon. Distinguished ministers, representatives of member states, members of the panel, I want to thank all of you, Javier Guzman from the Inter-American Development Bank, Vice Minister Cecilia Loxisano, I hope that I have pronounced correct your name, Camaria de Castro, Vice-Ministra de Saúde de Argentina, Cecilia Loxisano, la diretora médica from Antigua y Barbuda, Medical Director from Antigua y Barbuda, Camaria de Castro, the Chief of the International Relations in the Ministry of Health of Brazil, Marise Ribeiro Nogueira, and the Eric Peña Sanchez, Vice Minister of Peru. I really want to thank you because you'll be participating in this very important session for us. It's a pleasure to welcome all of you to this briefing session on the advances and innovative use of the regional revolving funds, one of the Pan-American Health Organization's flagship initiatives and a critical foundation of our technical collaboration with member states. For more than 4 decades, the revolving fund for access to vaccines has played a decisive role in contributing to elimination of vaccine-preventable diseases in the region of the Americas, while the revolving fund for strategic public health supplies has supported countries in securing key medicines, including antiretrovirals, saving countless lives. When I became the director of PAHO, I committed to strengthen these two mechanisms, expanding their reach and maximizing their impact in support of countries in our region. The regional revolving funds are unique, collective assets of the Americas. Their proven sustainable success has even inspired other regions in the world to adopt similar models. I have signed 2 agreements, one with the Africa CDC and another one with the Eastern Mediterranean Regional Office, because both institutions want to learn from our experience because they realize that this is the best way to increase the access of high-quality products by an affordable price, but also to strengthen the regional production capacity. By pooling demand and negotiating on behalf of our member states and guarantee quality, the funds have consistently secured the affordable and reliable access to life-saving health technologies to protect both populations and national health budgets. However, the context has changed. The COVID-19 pandemic reminded us of our dependency on global supply chains and the urgent need to establish agile responses to address rapidly evolving public health challenges. At the same time, we are witnessing a rapid pace of innovation and the arrival of new technologies, often highly effective, but also very expensive, that place great pressure on national budgets. In addition, member states' demands are shifting, and our revolving funds must advance just as quickly. I will continue now in Spanish.
This year, we've taken important steps in that direction. The revolving fund for access to vaccines has included frontline products, PCV20, for example. Pneumococcal 9, the strategic fund, offers more than 30 different treatments for pediatric cancer, as well as medications for breast and prostate cancers and rare diseases. These inclusions have mean that we have access to the most advanced technologies more quickly, combined with the necessary conditions to ensure their sustainability. At the same time, we are upgrading the operation of the regional revolving funds, introducing digital tools to carry out different processes, to strike up historic alliances with regional producers to strengthen the resilience of the supply and to broaden access to products which oftentimes are very difficult to procure. These innovations meet the priorities defined by our member states during the 61st Directing Council held last year. Colleagues, today's session is an opportunity for us to reflect on the achievement of the funds and to define their future. At this time, we have the opportunity to enrich the proposal to optimize their operation to ensure that they be prepared for the coming challenges. They will be essential to guide, or your reflections will be necessary for us to see how best to enhance these funds. You will hear more, in short, about innovations underway and concrete experiences of Antigua and Barbuda, Argentina, Brazil, and Peru, countries which are already using tools such as using these funds to strengthen regional production, in the case of Argentina, the initiatives of high-cost medications that many countries are now involved in. And a constant here is that the regional revolving funds are powerful tools for equity, solidarity, and resilience at the regional level. The same values that define the organization that brings us together. So I thank you for being here today. This is going to be an informative session, an opportunity to hear concrete experiences of countries and to continue to learn more about the revolving funds of PAHO.
Sorry, I'm kind of new at this. All right, I am now, we're going to hear from Dr. Santiago Cornejo, our Executive Manager from Regional Revolving Funds, to give us kind of a status and overview of vision and projects.
Thank you, Deputy Director, Director Barbosa, Dr. Barbosa, Member States, colleagues. It's an honor for me to present a brief update on the progress we have done in the Regional Revolving Fund against these priorities that you have identified to complement the work that we do in the region. Last year, you identified 3 priorities for us to focus. These priorities are to incentivize regional manufacturing, to have the ability to establish agreements for rapid response for outbreaks and pandemics, and to bring innovations and new products to our portfolios. Let me start very quickly on incentivizing regional manufacturing. I will give the example of what we have done on vaccines. In 2020, the revolving fund only procured less than 1.5% of its volume from regional manufacturers. This is less than 0.3% of the total value of our procurement for vaccines. So it was not a surprise that during the pandemic, despite the great capacities that we have in our region, our regional manufacturers were not part of this solution in an active and significant way. Last year, member states identified as a priority and approved a resolution that we should incentivize the revolving funds to utilize regional manufacturing. As of today, we have agreements with regional manufacturers that allow us to procure or allow us to supply up to almost a quarter of our volume from them. Furthermore, we're having conversations to include additional manufacturers and additional vaccines that will allow us to procure almost a third of our volume from our region. But more important, when we look at the share of the value of the procurement that will come from our region, is much higher than the volume. This is because we are focusing on the latest technologies, the latest vaccines, and those products that makes a difference. And we expect that very soon, almost half of the volume, of the value of what we will be procuring will be from manufacturers in our region. The second flexibility, and also to highlight that as I presented vaccines is not the only priority. We would like to have similar impact on diagnostics and other type of innovations. The second flexibility that you approved was our ability to respond rapidly to outbreaks and pandemics. Already we applied this flexibility this year. Thanks to this flexibility, when we saw the cases of measles increasing in our region, we were able to reserve 5 million doses of measles vaccines without a demand, that then when a member state came and asked for additional supply, we were ready to supply because we had already reserved it. Similarly for yellow fever, when we saw the increase of cases, the limited supply, we wanted to ensure that our doses will be supplied, so we work with the manufacturer to lock those doses, 1.5 million doses, to ensure that they will be distributed in our region. However, for pandemics, we know that it's not just rapid response during, but in advance. So we are working already in setting up those frameworks, those agreements that will allow our region to respond. We launched this year a process of RFP to work with manufacturers to have regional manufacture for vaccines for influenza in case of a pandemic. Now, these pandemic agreements for influenza are already available for high-income countries. All high-income countries, most of them have this type of agreements. However, this will be the first type of agreement from a regional level, from a middle-income countries, that we will have access to rapid access to early doses for critical populations in the case of an influenza pandemic. As a lesson of the COVID-19 pandemic, we're working and ensuring that we have also networks of our regional manufacturing. And we're able to do this thanks to your demand and your support through our seasonal influenza. We're leveraging the volumes of seasonal influenza to get these agreements and to improve the conditions. For seasonal influenza, we already decreased the prices more than 15% compared to 2022. We have accelerated the deliveries between 4 to 6 weeks compared to 2022. And now we will be also able to introduce new technologies like cell-based vaccine and to complement the egg-based platforms. The other priority was to focus, to bring innovations of our portfolio, and in that we are aligning for the revolving funds to contribute to our flagships of the Pan American Health Organization. We are designing packages and innovations to bring, to support and contribute to our agenda on better health, better care for NCDs in primary health care, for our elimination initiative, for our initiative on high-price medicine, and our telehealth program. In terms of, sorry, I will pass to Spanish now.
When it comes to better care for NCDs in primary health care, we have packages for different areas, whether it be cancer, diabetes, hypertension, respiratory diseases. In these packages, you will find the consumables that are available, whether it be for prevention, diagnosis, or equipment. And obviously, one can procure these jointly or individually. What we want is for you to have an integral approach or see the integral approach for these diseases. For the Elimination Initiative, we have products for 24 diseases under the initiative. 25 countries are already procuring, and Dr. Barbosa said about 9 million diagnostics and over 1.7 million in treatments. But we're also introducing new technologies, such as for advanced HIV, diagnostic treatment, for opportunistic infections, the most recent treatments for HIV. In the case of tuberculosis, we're looking into the necessary equipment, new diagnostics, and shortened treatment. Likewise, malaria. There is a need for nofricotin and new diagnostics. When it's HIV, Dr. Barbosa already mentioned the new vaccine, but there are new diagnostic tests, molecular tests, and different technologies that are actually critical for the elimination of these diseases. And likewise for other treatments, syphilis, hepatitis, and other respiratory diseases. The third initiative that we're supporting is the high-price medicine. And thanks to the request from Mercosur countries and then with the support of others, we identified diseases where there is a need for pooled procurement, as mentioned in the conversation that just took place by the Council. And here we identified several interventions. We have started working with member states, and we now have 5 products for 11 presentations to treat prostate cancer, breast cancer, and multiple sclerosis. Compared with the prices sent to us, you, member states, will see that the agreed prices are between 60 to 90% lower. For instance, a prostate cancer medicine that was reported to cost $50 to $70 per person is now available for $1 in the revolving funds. In the second phase we're going to work with these medicines. We're not going to stop with just these. We want to have breast cancer treatments and also metastatic melanoma, cystic fibrosis, as well as some neglected diseases. We also have treatment for pediatric cancer, more than 30 medicines available. And thanks to our participation on the global platform for pediatric cancer medicines, we have obtained very competitive conditions. I'd like to conclude with the telehealth program. Last year, at the Directing Council, we presented the 6 teams available on our telehealth portfolio. What advantages do they offer? Well, they have been designed based on our country's realities and needs. So when you look at the teams, the benefits is that they don't require much broadband. It's remote synchronization in order to reach remote areas. And if there is no internet, the information can be downloaded, and then when you have access to the internet, then download it. It's an open code software based on international standards. It means that these devices can communicate and be used with any kind of system. You don't need a membership or any specific type of software to use these devices. The spare parts are also universal. They're generic. They're not linked to a brand, so you can obtain spare parts. And then we analyze the devices to see which were needed, given or based on their cost, training requirements, and maintenance. We now have packages for the devices to ensure their maintenance, as well as training for people who will be using them throughout the region. Now we're going to hear from member states who are going to talk about progress in these priorities. But as the director pointed out, and we've heard earlier, another great priority is to optimize processes and to be more efficient in our operation as PAHO Revolving Fund. And we will present a short video afterwards showing how we're using innovation and technology to become more efficient in our work. Thank you very much.
Good afternoon. My name is Javier Guzman. I come from the Inter-American Development Bank, and it is a pleasure for me to moderate this panel. So if the panelists could please come to the front. And we're going to talk a bit about the country experiences. We heard a lot about what the funds are currently doing, but we want to put some reality to it and some color to it. So the first thing to say is, as Dr. Barbosa said at the beginning, the regional funds are key assets for the region. And we see how different regions, including Africa and the Eastern Mediterranean, are keen to engage and are keen to learn. We heard as well that the initial revolving fund was created over 40 years ago for immunizations. And a key aspect I want to highlight there is the burden of disease we had at the time and the challenges we had at the time are not the same as the challenges we face today. So before we start with the questions, I just wanted to give you a flavor of what those challenges are and how challenges have changed. So the first thing to say is we have an increasing burden of non-communicable diseases, and we expect to have 84% of deaths attributable to non-communicable diseases by 2050. The second, of course, is we have a fiscal crisis and difficult finances and sustainable finances. We at the Inter-American Development Bank did a study to project health expenditure, and we expect that the region will double health expenditure by 2050. Given all the different trends and all the different elements that we see, including longevity, including non-communicable diseases. So think about the sustainability of the system if we expect the expenditure to double by 2050. And last but not least, it's important to acknowledge that the region has made enormous progress in relation to access to healthcare, and the challenge is now quality. Quality is the challenge for the region, and we know how 70% of amenable deaths are due to quality, lack of quality, rather than to access. For all that, we need a very strong regional funds, and we at the IDB see the regional funds and see PAHO as regional assets we want to collaborate with and we want to escalate and work together on. So with that, I'm going to start with, an interesting experience in Antigua and Barbuda. First of all, welcome Dr. Camaria de Castro, Chief Medical Officer from Antigua and Barbuda. And we heard about the HPV vaccine, we heard about cervical cancer, but we know that the strategy is not only to prevent, but also to diagnose and to treat. Can you tell us a bit about how your country is responding to that big challenge of eliminating HPV as a public health problem? Welcome, I'm over to you.
Good afternoon. Thank you for the invitation to be on this panel today. So Antigua and Barbuda is in a peculiar situation where we are a small island developing state of a very small population and likewise a small health workforce. And we would have committed, of course, to the 70-90 targets for cervical cancer elimination. The Ministry of Health has worked closely with PAHO over the years with various teams in PAHO, coming from the Barbados ECC office in Barbados, as well as to the PAHO headquarters, in establishing the country's cervical cancer elimination program and the introduction of HPV vaccination and testing in the country, as well as for the treatment of cancer and of the cervix and precancerous lesions. So we introduced the HPV vaccination in the pilot program in 2021, and we built on that thereafter. The PAHO, the Regional Revolving Funds have made it been very beneficial to us to access these resources that are generally high cost outside of the revolving funds, and those would include the HPV vaccination and the HPV testing kits. And over the past 2 years, we have been able to provide vaccinations or receive, 3,000 doses of vaccinations in the country within the past year, and within the past 2 years, 4,000 HPV test kits. And we were able to offer over 2,000 HPV testing to women in 2024 alone. So all of this has been made possible through that partnership with PAHO and that providing that type of leverage that we need as a small country that generally would face a lot of procurement issues. And of course, one of the challenges we recognized is that the cost of shipping to the country far exceeds very often the cost of the supplies themselves, and that in itself does remain a challenge. So we're really grateful for that, and we also invest in that continuity of care where women who have been diagnosed with HPV or have had any precancerous lesions identified or cancer, they do get that access to health care that is subsidized at our tertiary level center, and the HPV testing in itself is free of cost. The government removed all of the user fees associated with that in primary healthcare services.
Thank you very much for this illustration and for the progress that has been made. What's the current coverage level of the HPV vaccine in Antigua?
So we provide HPV vaccination to boys and girls up to the age, well, the initial plan, I should say, would have been up to the age of 9 to 13 years. However, because of the low vaccination uptake, especially around the time of the COVID-19 pandemic, we realized that we would have to extend that vaccination access to other persons within our population. So we extended the age to 25 years. And we have had, for the first dose coverage, we've had less than 60% of our target reached. So we decided to collaborate with the Ministry of Education to start school campaigns for awareness for the general population, and more so for the children as well, to be involved, as they themselves do have play a role in their own decision-making about their health. And they do tend to provide some education as well, feedback to their parents. So we've done that. We've educated, involved the parent-teachers associations as well within the different schools through the Ministry of Education to increase that type of awareness.
Thank you, Dr. De Castro. Now let's switch to español y hablemos.
Let us talk about Argentina. One of the central points mentioned by Santiago in his presentation is how the funds can leverage an increase in manufacturing capacities. And we'd like you to tell us a little bit about Argentina's experience. But first, let me welcome Dr. Cecilia Losisano, Vice Minister of Health of Argentina. Thank you very much, Javier, and a good day to all. And I would like to thank the Pan American Health Organization for inviting me to participate at this very important panel. First, what I'd like to highlight is the strategic role of the Pan American Health Organization in implementation of public policies that are central for Argentina. And there are three aspects that I want to share with you, which I think are extremely important, and if you want afterwards, we can expand on them. But I think these are the most interesting and innovative in the application of the Regional Revolving Funds. The first is strengthening of the jurisdictional role of provinces in execution of public policy. In Argentina, our national constitution indicates that health is something reserved to the provinces. It is their jurisdiction. Provinces must provide public health services to the population, and the state has to decide the policies to be implemented. But this didn't happen. There were decades when the contrary happened. In other words, the central government provided goods and health services to the provinces, and this generated, with an overlapping financing, repeated programs, actions resulting in high inefficiency and difficulty to measure program impact. In order to change this paradigm, PAHO played a key role through signing of direct agreements with the provinces instead of going through the central or national government. Elements were given to the provinces so they could change. We showed them how they could change, and that is sometimes very difficult to achieve. So many provinces became interested. I think about 10 provinces today are joined, and some others are looking into this, and this could be for medicines right now, but it might become for vaccines later. And we're going to see if this strategy will have an impact in 2026 and lead to important efficiencies and savings for the provinces. That is one aspect. Another important element is greater access to medicine and vaccines. We received a significant PAHO support for this to analyze the specific situation in Argentina and our concrete needs with special budgets and responding to demand and incorporation of new technologies. Efficiencies are a road that we must take. In this case, we introduced the antiretrovirals for HIV, with a $2.1 million efficiency for 2026. We also added, under vaccines, the VCR, this is going to have an impact next year with a $3.2 million efficiency. And the anti-flu vaccine, which we have been working on in Argentina with PAHO support. And here we're anticipating a $3 million efficiency next year. It's also important to point out what we did with these savings. We were able to provide rapid responses, Santiago pointed out, for the measles outbreak with PAHO support. We procured 900,000 additional doses to control cases in the areas where there were outbreaks. Then, for instance, we decided to improve measles, rubella, and mumps coverage, increasing coverage at 18 months, adding a new cohort which required an additional investment. And thanks to these efficiency, we had the budget available, the resources available to be able to scale up this program. Lastly, we have reinforced regional production through technology transfer experiences. This is something that you mentioned about PCV20, where Argentina incorporates this new vaccine, or this new technology rather, through transfer of production from a European plant to an Argentine one with a 20 million private investment and an expectation of receiving foreign currency in a country, $1 billion over the next 10 years. And this is thanks to an agreement with PAHO for production to be distributed regionally in the Americas. So I just wanted to mention these topics. I do think they're very important. We're seeing here joint work, and it has a lot to do with understanding in the country and needs. And this, thanks to this support, it was possible to implement policies that are crucial for Argentina right now when it comes to efficiency and resource allocation, which provides better care with better quality, meeting the needs of our citizens. Thank you very much. You mentioned, first of all, the relationship with the province, 2, efficiency, and 3, increasing local manufacturing capacities. Under the first topic, could you talk a little bit more about the role of the federal government and the role of provinces? How do they decide who procures from the fund? How is that relationship set up? That's an interesting question. This possibility of signing bilateral agreements with the provinces existed, and actually some had been signed but not implemented. So the step we took, the innovation, was providing support to the provinces for this to happen. We have the National Health Council that brings in all the ministers of health in Argentina to discuss policies. And we received PAHO support there again to introduce or present this modality. It was explained, work was carried out with each province, very close coordination, and we achieved something that finally had not been managed before, and that was full implementation of the agreements. What we want is for the provinces to once again take upon themselves the responsibility of providing health goods and services to their population, and the federal government to focus on the governance and information systems that will help all of this to happen. Thank you very much.
And we are going to talk about cancer, and we're going to talk about, the case of Brazil. So let me welcome Maris Ribeiro Nogueira, Chief Special Advisor Office for the International Affairs in Brazil. And we heard from Santiago that, one of the key challenges at the moment, but more importantly going forward, is high-cost technologies that are also cost-effective, so benefit, but also high cost. Can you talk a bit about what Brazil is thinking in relation to access to those technologies and how the regional funds could help in addressing that challenge?
Thank you, Javier. But indeed, we are moving to Portuguese now, if I may. Muito obrigada pelo convite para.
Would like to express my gratitude for inviting me to participate at this discussion that's so important for Brazil. And once again, we would like to thank the welcome provided by all the countries for the remote participation of our minister. And once again, we want to express our regret for the access of the minister to come to this meeting, which is so important for us. If it had not been for that, he would be here instead of me. I'm here as a delegate, really, and I'm going to seek your indulgence to read part of our reply. This is a challenge that has been imposed on us, plus a pleasure allowing me to share with you our experience using the RRFs, which is very important for Brazil. And that's what I wanted to clearly state at the outset. Brazil, contrary to other countries, such as, for example, was mentioned by a colleague from Antigua and Barbuda, is a very important market. So the facility, the ease to negotiate is much easier when you're talking about a population of over 200 million inhabitants. However, it doesn't mean that the funds are not important and that joint negotiation is not one of the aspects that is truly crucial for the national policy for access to medicine and vaccine. Let us also recall that Brazil is a manufacturer and therefore is also one of the other sides of the coin of the Brazilian public institutions, and we have been able to provide to PAHO medicines and vaccines. This being said, I'd now like to share with you that the pharmaceutical industry is very important for the public health of Brazil, guided by national policies aiming to ensure the efficacy and safety of medicines as well as the population's access to medicines that are considered essential. The national list of and agency in charge of reports of medicines says which have to be used. And within Renani, this agency, there is a specialized component for pharmaceutical assistance that makes it possible to access medicine for more complex medicines such as oncological drugs.
Constituem instrumentos.
In Brazil, public procurement are important for the Brazilian policy, thus allowing to have supplies at a lower cost. So we internally are doing what we're also doing together with PAHO. All these options in bringing down the cost of medicines and vaccines, as well as other health supplies, have to follow a universal access policy in Brazil. When the treatment is not part of the SUS and it is presented by the legal procedures, that is to say, having to follow through the legalization of the drugs, this benefits individuals in an unequal way, thus leading to dislodging of the supplies that leads to broad policies and turning it into individual supply, thus giving benefits for individual profit. This led to a legal process that is connected to the performance of mechanisms such as the strategic revolving funds of PAHO that supports countries in the structuring of their health policies in expanding the scale of procurement by reducing prices and thus contributing in order to ensure availability of strategic supplies. Currently, the strategic fund plays an essential role in the procurement of medicines for TB, malaria, and leishmaniasis fever, and treatment with ARV. The mechanism also enables us to understand without any registry in Brazil or those that can be acquired which are temporarily not available in the country. With that, we have centralized procurement with greater savings through scale procurement and forces health control with the basis of a pre-qualification of providers and drugs as established by WHO, ensures a response to health emergencies through mechanisms that have already been structured on procurement that ensures a rapid compliance with supplies available, even those that have active health registration but without marketing at that specific time. It is suffice it to say that the supplies acquired through the strategic fund of PAHO are framed within national rules and regulations that established the procedures for import following the exceptional nature of products subject to health surveillance that do not have a registry in Brazil. This means that they are acquired by suppliers and drugs and medicines that we still, in Anvisa, which is the Brazilian regulatory agency, has not approved in specific cases. Hand in hand with this cooperation that has already been consolidated, the demand of beginning with the first procurement of oncological supplies in partnership with PAHO. We're negotiating the possibility of procuring palbociclib, which is a drug used in the treatment of breast cancer. And people can share with you, we can share with you the fact that already through the use of the revolving fund and the joint performance with Brazil, one of the manufacturers has already offered initially a drop of 26%, that is to say, a reduction in 26% for the procurement of these medicines. Aside from these medicines, for example, in the field of expansion of therapy, the Ministry of Health, through the centralized procurement system, also ensures greater savings and activity in the provision of equipment for hospitals that has already been activated for oncological treatment. And aside from that, the local production is essential in order to reduce dependence and be able to deal with vulnerability in supply chains. This is something that we have focused as a priority in order to reduce the dependence, that is to say, external dependence, not only in Brazil, of our entire region. During the Brazilian presidency of the G20, the issue of national production was one of the central issues in the discussions with active participation of PAHO. And as a result of that effort, the Global Coalition for Local and Regional Production was created, also for innovation and equitable access. And this was officially launched in May as a side event of the World Health Assembly. In the Brazilian presidency, the BRICS once again launched a partnership for socially determined diseases and conditions that also ought to contribute to that raise in production and innovation in our region. And last but not least, with the current pro tempore Brazilian presidency of Mercosur, one of the objectives is to take advantage of the Mercosur-European Union agreement, amongst other means, in order to provide access to the private sector to strategic revolving funds of PAHO. The revolving fund and the strategic fund are central mechanisms for regional technical cooperation, which are extremely important to provide equitable access that has promoted significant progress in the field of health for our region. The challenges faced in the past attested to the importance of strengthening regional capacities and skills, particularly in production and innovation, areas in which the revolving funds act as a huge catalyst. This strengthening contributes to health security, expanding access, and the guarantee that the new supply chains will be resilient, ensuring continuity in the supply of innovations in health. Thank you very much.
Obrigado.
Thank you very much.
Important to highlight that this is the first time that Brazil gets into an agreement with the regional funds to procure a high-cost, high-efficacious medicine. And we are very excited to hear that milestone, and we are very excited to see more of that happening. And thank you very much for highlighting the leadership Brazil has had on local manufacturing within the G20, within the BRICS, within the Mercosur. Very important point in relation to what Santiago presented, the role of the regional funds. And finally, let's talk about equipment. Ya hablamos de...
We've already talked about medicines, we've talked about vaccines, but we have not talked about equipment. And it seems to me that it is important to hear about the experience in Peru in this procurement of equipment specifically for telehealth. Welcome, Dr. Eric Peña Sanchez, Vice Minister of Public Health in Peru. What is your experience? Thank you very much. First of all, I'd like to thank you for the invitation and having the honor of addressing this important information session. In fact, first and foremost, I'd like to define the context of the priority that the current Peruvian government and the ministry has on telehealth. We are all kept much more current and brought to the discussion table. We have the technologies that have to do with health during the pandemic. This is something that was discussed. But reviewing the usefulness of these strategies and tools, it becomes much more evident that when one addresses barriers on geographic access, and besides the significant gaps in human resources of a specialized nature that are responsible for procedures, much more complex procedures, and to bring them to primary health care is crucial in order to provide the strengthening of that care from the first level. And in this regard, telehealth and digitizing services of care in our country constitutes a very important priority, and it is within that framework. And I will give you one of the examples for my statement, because this constitutes a priority for the ministry in Peru and the current government, in the sense that we've deployed a whole set of aspects, such as, for example, tele-certification of disabilities. The population of people with disabilities has very little access to the process of certification. And besides the social assistance provided by the Ministry of Development and Social Inclusion, but that's one of the sides of this whole complex strategy in dealing with telehealth. And one of the examples, which is the object of this panel, is the issue of cancer. Breast cancer is the second cause of mortality in the women in Peru. It is estimated that more than 7,800 new cases a year is what we have, and 2,000 deaths caused by this disease annually. And one of the factors that has an impact on this is a late diagnosis. A huge number of breast cancer cases are identified or diagnosed in late stages, advanced stages of the disease. Thus, it constitutes a priority to detect at an early stage, and on that, we're obviously faced with a gap in infrastructure, in specialists that will perform the diagnosis in this specific case of mammograms. And by responding to that juncture, the Ministry of Health of the Peruvian government has designed the development of an aggressive initiative in telehealth strategies. We've acquired or procured 63 digital mammograph pieces of equipment with the equipment in order to develop telemammograms. In 25 of all the regions in the national territory, we have the White March at the beginning of 2025, as it is known, in order to promote the exercise of these telemammograms with a lot of success. We've reduced the diagnosis time to 5 days, which in the past used to take much longer, 5 to 10 times more in some remote territories spread out in the territory. And this is a huge improvement in terms of access and availability for this population. Now, this progress that we believe is vital for closing gaps and the possibility of having an early diagnosis in this prevalent problem in our country is tied to the revolving funds, because we have the possibility, as has already been stated in the first presentation, in the sense that there is a possibility of acquiring these equipments for telemedicine with certain characteristics that standardize the procedures and that even make it much more applicable to have the intervention, the use of free software, training to the professionals for the implementation and use. So it is really important, because it turns out a huge advantage that in the region could be standardized and we could move forward with its implementation. On the other hand, it is also critical to consider that the supply, the offer of this procurement could be taken a step further in order to guarantee that the processes of interoperability of the information, and this is critical, for example, not only that the procedure itself or the digital image will be transferred from the place where the care is being provided to the specialized institute or the hospital where the professionals operate in order to have a timely reading. And for these to be performed, but also these systems can interoperate with the information systems, with the records, with the electronic histories that we have, so that we can develop a solution that will respond more efficiently to this need. Aside from this, we can also see aspects related to training and a whole set of advantages offered by the use of these revolving funds. For us, the telehealth initiative not only constitutes a priority, but it constitutes an opportunity in order to provide much faster and in an efficient way the services, precisely offering this to these populations where access turns out to be complex, and therefore it is much more difficult to reach on a timely moment to take care of the patients. Thank you very much. Could you tell us a little bit about how easy or how difficult it was to move to do this telehealth with the mammograms? Was there support in the process of training people? How easy is it in order to be able to do this? It is always a challenge to move forward in implementing new strategies or initiatives in an institution such as the Ministry of Health in general, and in the establishments or in the areas that provide services in the territory. There is reluctance, in a way, to progress, to leave the status quo, the comfort area in the regular work that we do. But undoubtedly, the decision not only came from the highest level of the ministry, but also due to the fact that the experience that we've had during the pandemic and the initiative of considering this as a strategy in order to bring this service to the population has become the incentive for health professionals to feel committed and motivated in order to be able to respond to this work. I am very committed to this work on telehealth, but I would also like to add to the points that have been brought up very briefly, because the work we do seems to be very important with the strategic medicines and with high-cost medicines, saying that this is one of the problems that we're addressing in our country. We faced judicialization processes, high-priced technologies, which constitute a serious problem, and we're taking important initiatives in optimizing the legal and administrative framework in order to assess health technologies, but that would have the component of the economic value included also on the award rendered, and also to begin rendering together with the procurement law of the country the agreement of the coverage of procurement that is managed or administered by the government. This is what I can contribute with. Thank you very much to our panelists. A big round of applause for them.
Vamos a
Let us now go back to our places, and in the meantime, we'll show a video on the regional fund, and then we'll continue with the statements by the different countries. The questions will take place a minute after we finish with the video.
Antes, planear la adquisición de vacunas, medicamentos y suministros podía tomar a los países horas y múltiples hojas de Excel. Hoy, todo se hace en minutos en un solo portal. Este cambio inició en el 2023 con el lanzamiento del portal de Estados miembros de los fondos rotatorios de la OPS, una plataforma en línea para los países que permite centralizar la información y los procesos de compra del Fondo Rotatorio de Vacunas y el Fondo Estratégico. Cada año, los gerentes de programas nacionales de salud pública que participan en los fondos consolidan las necesidades de medicamentos, vacunas y otros suministros para sus poblaciones y las envían a la OPS, quien realiza una compra conjunta con todas las solicitudes recibidas de la región. En el pasado, los gerentes de programas realizaban estas solicitudes completando hojas de cálculo, pero hoy solo toma unos cuantos clics. Esta plataforma es una ventanilla única que agiliza el trabajo y fortalece la salud pública.
Me parece que es algo muy positivo para nosotros, nos agiliza mucho más. Obviamente estamos viendo que todo se va modernizando y se van generando herramientas digitales. Me parece que está muy bueno.
Tras su lanzamiento, el portal ha incluido mejoras, como un rediseño de su interfaz y 2 nuevos módulos en junio de 2025. Seguimiento a finanzas y compras, con los cuales los usuarios pueden monitorear recursos, línea de crédito y el avance de sus pedidos en tiempo real.
Nos permite dar seguimiento a nuestros pedidos, a nuestros inventarios, a nuestras necesidades, y eso siempre representa una ventaja para el funcionamiento de la cadena de suministros, especialmente para nuestras instituciones que somos prestadores de servicios de salud.
Tras 2 años de su lanzamiento, el portal tiene 800 usuarios activos. Los módulos de finanzas y compras se han consultado más de 1.500 veces y ha permitido la entrega oportuna de los planes de demanda anuales por su facilidad de monitoreo en tiempo real.
I'm happy for the digitalization. This is an easier way of doing it.
Los fondos rotatorios regionales de la OPS continuarán buscando mejorar la experiencia y la transparencia en la información, facilitando así la rendición de cuentas en sus Estados miembros para ofrecer cooperación técnica sólida, demostrando que juntos somos más fuertes.
Okay, now we are happy to take questions, but before we take questions, I think we need to give the floor to the member states, I was told. So if any member state is keen to say a few words or to make a question, it is the time. If not, okay, there's a burning question over there. Please go ahead.
Hola, buenas tardes.
Hello, good afternoon. My name is Beatriz Champagne. I am with the class of the Healthy Americas Coalition. And I wanted to ask you if you have considered the possibility of including in the fund cystine that has recently been included as an essential drug in order to assist those who smoke to quit smoking. And it is a very effective, low-cost treatment. Therefore, considering that we have millions of smokers in our region, the possibility that many will quit smoking will be really good, because we know that more than 70% of those who smoke wish to quit smoking and they cannot do it. And it is called cystine. And maybe some of you have already heard about this, and WHO has it now as an essential medicine. Thank you very much. We address this question to Santiago. Thank you very much for the question. All these products that are on the list of essential medicines of WHO are eligible for the revolving funds, so it is eligible. The most important thing here is the need for consolidating the demand in order to be able to get these good conditions for the region, not only beneficial conditions regarding prices, but also delivery times and the quality of the product. So what we need is the demand by member states to be able to manage that procurement, but it is eligible for the procurement fund. All the products in the essential list are eligible. And additional questions? Any additional questions or comments? Should there be no additional questions, then I'd simply bring this to an end, expressing my gratitude to the panelists, to Santiago, for presenting this. And I'd like to close just like we started. I believe that the fund is a very important regional fund that is undergoing a process of evolution in order to better respond to the challenges of the future faced by our region. And we hope that these initiatives of new products for high-cost diseases, of favoring or promoting local manufacturing, in having a much more efficient approach, will materialize as best as possible for the well-being of our region. Thank you very much, and I now give the floor to Assistant Director Rhonda Seeley-Thomas.
The session.
Thank you. Distinguished colleagues, partners, and friends, as we conclude this important session on the advances in the innovative use of the Regional Revolving Funds, I want to express my sincere gratitude to all of you for your active participation, thoughtful insights, and unwavering commitment to improving health across our region. In particular, I acknowledge the distinguished members of our panel from Brazil, Argentina, Antigua and Barbuda, and Peru. Allow me to also thank Dr. Javier Guzman for moderating this session and for the long-standing partnership between the Pan American Health Organization and the IDB. Gratitude is also extended to Dr. Barbosa, our Director of PAHO, for his opening remarks, and our Deputy Director for guiding us through today's proceedings. I also want to express gratitude to Dr. Santiago Cornejo and his team for organizing this session. Today's discussions has made it clear that PAHO's revolving funds remain not only vital mechanisms for pool procurement and equitable access, but also dynamic platforms for innovation. And as I close this session, I am even more convinced that innovation is the key to advancing public health achievements. As has been highlighted by our panelists, innovation is not only about adopting new technologies. It is a major step in ensuring the availability of our products in our region that otherwise would take years to arrive. Innovation also means transforming our processes, financing models, partnerships, and institutional capacities. It is about rethinking the way we work while staying grounded in evidence, equity, and regional solidarity. Whether through digital transformation, stronger regulatory alignment, or integrated supply and chain strategies, PAHO's regional revolving funds are evolving through innovation to meet the needs of member states in a dynamic 21st century geopolitical, financial, and health landscape. The examples shared, ranging from expanding vaccines access, telehealth, and to leveraging strategic partnerships and financial tools, are testament to the power of our collective action and innovation. My closing request is for us to build on this momentum and to continue strengthening and supporting the regional revolving funds. When we work together as one region, we can achieve our goal that every person in every country in the Americas has timely and equitable access to essential health products, no matter where they live or their ability to pay. Let us all take action now to collectively build accessible health technologies for the Americas through PAHO's revolving funds, ensuring that innovation reaches everyone and improves the lives of the people of the Americas. Thank you so much for your participation and contribution.